I'm Sara Chopdekar and today I am going to speak about heart diseases and ECG. The diseases and conditions affecting the heart are collectively known as heart diseases. The heart consists of a muscle that pumps blood, arteries that supply blood to the heart muscles, and valves that ensure that the blood within the heart is pumped in the correct direction. Problems can arise in any of these areas. To have an overlook of the internal view of the heart, there is right atrium, right ventricle, left atrium, left ventricle, pulmonary valve, pulmonary veins, tricuspid valve, aortic valve, mitral valve, pulmonary arteries as well as aorta. Blood circulation, just have a look of how from body tissues the blood rushes through the lungs and back to the body tissues. Heart disease is an umbrella term for a number of different diseases which affect the heart. The most common heart diseases are coronary artery disease, coronary heart disease, ischemic heart disease, cardiovascular disease, heart failure, and many more. Coronary artery disease, CAD. There are diseases of arteries that supply the heart muscles with the blood. CAD is one of the most common forms of heart disease and the leading cause of heart attacks. Coronary heart disease, a disease of heart itself caused by accumulation of atheromatous plaques within the walls of the arteries that supply the myocardium. Ischemic heart disease, another disease of heart itself, characterized by reduced blood supply to the organ. Cardiovascular disease, a sub-umbrella term for a number of diseases that affect the heart itself, the blood vessel system, especially the veins and arteries, leading to form the heart. Pulmonary heart disease, a failure of right side of the heart. Hereditary heart disease is caused by inavoidable genetic factors. Hypertensive heart disease caused by high blood pressure, especially localized high blood pressure. Inflammatory heart disease that involves inflammation of the heart muscles or tissues surrounding it. Valvular heart diseases that affect the valves of the heart. Pericardial diseases. These are diseases of sac that encases the heart, that is pericardium. Pericardial disorders include inflammation, that is pericarditis, fluid accumulation, that is pericardial effusion, and stiffness, constrictive pericarditis. Congenital heart disease. These are forms of heart disease that develop before birth, congenially. Heart failures, often called congestive heart failure, is a condition in which heart can't pump enough blood to the body's organs and tissues. Heart disease risk factors include smoking, genetics, age, diabetes, high cholesterol, stress, alcohol, unhealthy food, and obesity. Now we move on to the diagnosis part. Tests to diagnose a heart disease include electrocardiogram. The first test done to diagnose heart disease records electrical signals as they travel through the heart. Doctor recommend this if chest pain, breathlessness, dizziness, fainting, feeling of heart fluttering, thumping or pounding. In this, small sticks, dots, electrodes and wire leads are placed on patient's chest, arms and legs. Leads are attached to ECG machine which records the electrical activity of the heart muscles and displays it. A nuclear stress test. It is an imaging test that shows how blood goes into the heart and rest and during exercise. It uses a small amount of radioactive material like thallium or sesame will be injected into one of the veins. You will lie down and wait for 15 to 45 minutes. A special camera will scan your heart and create pictures to show how the substances traveled through the blood to your heart. After this, you will also be made to walk on a treadmill. If you are not able to walk, you may be given a medicine, vasodilator, which will dilate your heart arteries. Your blood pressure and heart rhythm will be monitored throughout the test. CT scan. A computerized tomography (CT) scan combines a series of X-ray images taken from different angles around your body. It provides us with soft 3D images of bones, muscles, as well as organs. Echocardiogram. This test shows how blood moves through the heart and heart valves. Coronary catheterization. Coronary angiogram is a procedure that uses X-ray imaging to see your heart's blood vessels. The test is generally done to see if there is a restriction in blood flow going through the heart. Cardiac CT or MRI. Magnetic resonance imaging. Magnetic resonance imaging (MRI) is a medical imaging technique that uses a magnetic field, a computer-generated radio waves, to create detailed images of organs and tissues in your body. They can help show the severity of heart damage. Now we move on to the most complex and important part, that is the electrocardiogram, commonly called as ECG or EKG. The electrocardiograph includes electrocardiogram and waves. So these waves will include P wave, QRS complex and T wave. Normal wave looks something like the first one, P, QRS and T. The second one, that is the hypokalemia, depicts deficiency of potassium ions by small elevation after the T wave, that is the U wave, indicating hypokalemia. Next, hyperkalemia, which indicates more of potassium ions by greater elevation of T wave, and P wave is slightly depressed. Hypocalcemia, as per the name suggests, it depicts deficiency of calcium. It is shown by ST segment is straightened, T wave is broad and enlarged towards the end, whereas hypercalcemia means more of calcium ions by there is no ST segment. T wave is shifted earlier because of overactivity of parathyroid gland. Next, we move on to calculate or to assess the rhythm and rate of the electrocardiograph that we receive. This is the normal sinus rhythm. Now we'll look at how it is calculated or seen as a normal sinus rhythm. Before that, we should always confirm that device speed should be 25 mm per second. It is given at the bottom of the picture, you can see. So to first calculate or to assess the rhythm, we should first look at the lead 2 given at the bottom, which is at the bottom. So we see that the R wave or the QRS complex, so between every QRS, that is between every R interval, how many small boxes are present. So here we can see there are like 4 to 4.5 boxes. So round figure we can take it as 4 boxes. So between each R interval it is regular 4 boxes. So we can conclude that RR interval is at regular distance. That is the normal. If irregular rhythm is something like this in atrial fibrillation, there are no equal number of boxes between the 2 R waves. Here it is shown atrial flutter. There is a fluttering thing shown between the 2 R waves. At the end, irregular rhythm, that is seen second degree heart block type 2, which depicts normal regular rate with regular drop beat. Moving further, we assess the RR interval. First we'll look on to the rate and then we'll move on to the P, QRS, RR interval and QRS complex. First we'll look on to the rate. To assess the rate, of regular rhythm, we take the formula as regular rhythm is equal to 300 by regular interval, that is 300 divided by, we took the 4. So in the previous example there are 4 boxes, so here we can take it as 300 divided by 4. So approx it comes to 75 bpm. This is in case of regular rhythm. If we take in the case of irregular rhythm, the formula changes to number of R waves in 6 seconds into 10. So here the formula differs. Now we'll take another example of normal sinus rhythm. Here also there are equal number of boxes between the R wave RR interval. If we look into the second lead, that is at the bottom. So here we assess RR interval, P wave, P to QRS and QRS. So first we have already assessed that there are equal number of boxes between the R waves. Secondly, we assess the P wave. So in order to assess the P wave, we need two things. Lead 2 should be upright. So we can see the second wave from upside up, that is the both complexes are seen in the upright position, whereas the second point should be ticked, that is in the lead 1 AVR the waves should be inverted. So this we have achieved. So it is second lead is upright, whereas the first lead AVR is inverted. So here we come into conclusion that it is a sinus rhythm. In order to assess the P to QRS, we see that we want every QRS complex to come after the P wave. So we look into the lead 2, that is at the bottom. We see that every QRS complex is after the P wave. So this is what we want. So here we consider it as AV association. And the last one, that is QRS. How we assess the QRS complex? That if we look at lead 1, the QRS, the S depression mainly includes like the 2 very small boxes, so it is narrower, so we can take it as a narrow. So this rhythm is regular sinus AV association narrow rhythm. There are many more aspects that we can include to calculate the rate or to assess the electrocardiograph. Here are some more examples. Here are some ways to keep your heart safe and yourself fit and healthy. Manage your blood pressure, manage your blood sugar levels, follow a healthy and eating pattern, move more, be smoke free, drink less alcohol, reduce stress, maintain a healthy weight. Thank you.